Good day, everyone. Hi, it's me again, Nurse May from BSN A1, and for today's return demonstration, I'll be showing you the personal hygiene care of the patient that is composed of bathing, hair shampooing, oral care or brushing, then the facial hair removing, then the perineal and genital care, and of course the nail and foot care. In every procedure, there are 3 steps or procedure that we must do first. These are to introduce ourselves and to verify the patient's identity. Then, of course, to knock the door, tell the patient what you are going to do, explain to him or her the importance or the significance of the procedure. Then, to do the hand hygiene. This is to prevent transmission of microbes. In today's return demonstration, we'll be doing the hair shampooing, and the equipments needed are bath towels, shampoo basin, blanket, bath blanket, plastic pad, and a shampoo. Step number 1. Introduce self and verify the client's identity. Good morning, sir. Hi, I am Nurse May. I'll be doing your hair shampooing today. Then, perform a hand hygiene. And now, provide the client a privacy. It's either to close the door or to close the curtain. Move the client to the side of the bed from which you will work. Hello, sir. I'll be moving you upward where I am going to do your hair shampooing. The next thing that we are going to do is to get the patient's pillow. Then, place the plastic pad under the head, tack a bath towel around the client's neck or shoulder, and place the shampoo basin under the head. So, as if this is our plastic pad, and this is our towel, and of course our basin. Now we are going to place a folded washcloth where the neck rests on the edge of the basin, as if this is the folded washcloth. Now, place the receiving receptacle on the table or chair at the bedside. Put the spout of the shampoo basin over the receptacle. And then we are going to brush or comb the patient's hair. This is to loosen any tangles. Place a damp washcloth over the client's eyes, and then wet the hair through roughly.
Now, we are going to apply shampoo, massage the scalp with the pads of our fingers. Rinse the hair briefly and apply shampoo again. Make a good lather and massage the scalp. And then, rinse the hair through roughly and dry the hair through roughly. The last step that we are going to do is to document any assessment and to assess the client into a comfortable position. Are you okay, sir? Lift your head, sir, for me. Wait a minute, sir. Okay. So the next return demonstration that I'm going to do is the oral care or brushing. The first step is to assemble the equipments for brushing. In oral care or brushing, we'll be using a towel, disposable gloves, emesis basin, soft bristle toothbrush, toothpaste, and a cup of water. After assembling our equipments, the next thing we are going to do is to provide privacy. It's either to close the door or to close the curtains. Then, the next thing is to do a hand hygiene or to wash our hands. And put some disposable gloves. After putting some disposable gloves, we are now going to assist the client to place the client in a high fallers position. Then, place or hold the emesis basin under the client's chin or neck. But before that, we must also hand the toothbrush to the client with the toothpaste. Make sure to moisten the bristles with water. Hand the toothbrush to the client or brush the client's teeth if he or she is not able to. In brushing the client's teeth, hold the brush against the teeth, move the bristles up and down gently in short strokes from the sulcus to the crowns of the teeth. Repeat until the outer and inner are clean. Make sure to clean the biting surface and, of course, to brush the tongue. Offer the client a cup of water to rinse. Then offer the client a towel to wipe his face. After, document assessment of the teeth, tongue, gums, and oral mucosa.
In the shaving of hair or facial hair return demonstration, the first thing that we are going to do is to wear disposable gloves, or to put on disposable gloves. Then we are going to apply shaving cream to the patient's face and hold the skin tone, especially around the creases, and to hold the razor in a 45-degree angle to the skin, of course. Then shave in short and firm strokes. Then after shaving, we are going to wipe the entire area with a wet washcloth, and the last thing that we are going to do is to dry the face well and pat on after shaving. We are going to pat on and put some lotion. So since our client or our patient doesn't have any facial hair, so shaving facial hair is not a must. Good day, everyone. So for today's return demonstration, I'll be doing the bed bathing, and the equipments needed are the following. Of course, we'll be using a basin with water, some towels. This is the towel that I'm going to use to put on the shoulder or the pillow of the patient. Another towel. This is the bath blanket, as if. The washcloth. We have comb, lotion, alcohol, and deodorant. And of course, a box of disposable gloves.
The first step that we are going to do is to introduce ourselves and to verify the client's identity. Then, explain to her or him what you are going to do.
Good day, sir. I am Nurse May, and I'll be doing your bed bath today. Can you tell me your name, sir?
JBD Casmina,
And your birthday, sir?
April 7, 2011.
Okay, thank you, sir.
Then we are going to provide privacy for the client. It's either to close the door or to close the curtain. After providing the client's privacy, we are now going to prepare the client and the environment. Ensure a comfortable room and temperature. Encourage the participation of self-care as possible and assist each area of the skin. Then, we are going to position the client appropriately. This is to avoid undue reaching and restraining that promotes good body mechanics. It also ensures client safety. Since our client is already in a comfortable position, we are now going to place the bath blanket over the top of the sheet. Then remove the top of the sheet starting at the client's shoulder and moving down linen towards the client's feet. As if this is the bath blanket. Then immediately put the linens to the linen bag without touching it into your uniform. Now we are going to remove the client's gown while keeping the client covered with a bath blanket. This is to provide unnecessary exposure and to provide warmth to the client. Now we are going to make a bath mitten with the washcloth, and we are going to start washing the face as if this is the washcloth. By the way, before anything else, we are going to ask the client if he wanted to take the pillow, but if he doesn't want, we are going to put a towel on his neck or his head. This is to avoid the pillow from getting wet. Sir, you want me to get your pillow or not? Okay, so I'm going to put this on your head and neck to cover the pillow. Are you comfortable, sir?
Yes.
Now, we are going to wash the face of the client or the patient using the mitted washcloth. After washing the face of the client or the patient, make sure to dry it well too. Now we are going to wash the arms and the hand of the patient. Place a towel lengthwise and in the arm away from you. Then use long and firm strokes from the wrist to the shoulder, including the axillary area, and repeat it to the other side of the arm and hands. Sir, we are now going to clean your hands and arm. Using a different washcloth, mitted washcloth, we are now going to wash the patient's hand. After doing the right side of the patient's arm and hand, we must also do the other arm and hand. After washing the face and the arms and hands of the patient, now we are going to wash the chest and abdomen of the patient. Place a bath towel lengthwise over the chest, holding the bath blanket down to the client's pubic area. This time we are now going to wash the back of the client. First, we are going to assist the client into a prone or side lying position, facing away from you. Then, place the bath towel lengthwise along the side, the back, and the buttocks. Keep the client covered with the bath blanket. Wash and dry the client's back from the shoulder to the buttocks and upper thighs.
Okay, sir. Move to this side. We are now going to wash your back and your buttocks, from the shoulder to your buttocks. You can now go back.
At this moment, we are going to wash the legs and the feet of the client. First, we are going to expose the leg farthest from you. Then we are going to fold the bath blanket towards the leg, keeping the perineum covered. Then place a bath blanket lengthwise under the leg and use a long, smooth, and firm stroke from the ankle to the thigh. After doing the other leg and feet, we are going to do the other one also. And then dry each foot well.
After doing the other side of the foot, we are now going to do the other one also.
The next procedure that we are going to do is to drape the client and wash the perineal area. Sir, now I am going to do your perineal area. You want me to do it?
No.
Okay, so the client insists that he doesn't want us to clean his perineal area. So, since he is able to do it, we'll leave it to him. After doing the perineal area, as if that we already did it, we are now going to help to put clean gown to the patient.
Okay, now Now, sir, we are going to put your gown.
After assisting the client to put on the new gown, we are now getting the bath blanket and put it to the linen bag, and of course the towel in the head or in the pillow of the patient.
We are now going to give the client a new blanket and offer him if
He wanted us to offer him deodorant and lotion, but if the client insists that he can do it, we'll leave it to him. In my case, the client insists that he'll be doing the lotion and the deodorant part, since he is able to.
Are you comfortable, sir?
Yes.
Okay.
we are now in nail care. So the equipments needed in nail care are basin with water, hand lotion, nail cutter, nail stick or orange stick, nail file, and towels. Step 1 is to soak hand in the basin of water and then dry well. Cut straight across beyond the end of the finger. After cutting the nails, use a nail file to around the corners and then clean under the nail. After, gently push back the cuticle, take care not to injure it, and apply hand lotion or mineral oil. Then, record and report any abnormalities. Now, we are going to do the foot care return demonstration. After introducing myself and verifying the client's identity, and after explaining what I am going to do, I am now going to perform a hand hygiene. Then, I am going to provide the clients a privacy. It's either to close the door or to close the curtains. Then, place the client's feet on the basin with water. Wash with soap including the interdigital areas. Then, rinse the foot well. After soaking the foot for 10 to 20 minutes, we are now going to clean the nails with orange stick. After cutting the nails, we are now going to apply lotion or foot powder and document any foot problems observed. By the way, we are don't forget to um, don't forget to use a nail file to around the corners.
Oh, even though our patient said that it is not necessary anymore to do um, perineal care to him, but I believe that it is a must to be familiarized, or we must memorize the procedure of perineal and genital care. So the first thing that we are going to do is to, of course, we need to introduce ourselves, verify the client's identity, do a hand hygiene, provide privacy to the client, and tell her or him the importance or the significance of the procedure. Then we are going to fold the bed linen, the top bed linen, and um, we are going to expose the perineal or the genital area, and we are going to place a bath blanket under the legs or the hips of the client.
For females, we are going to place them in a back-lying position with knees flexed and spread well apart. Cover the body and the legs with bath blanket. Then drape the legs. For male, we are going to place them in a supine position. Then knees slightly flexed and hips slightly externally rotated. Then inspect the perineal area. Now, for females, we are going to clean the labia majora and folds between the labia majora and labia minora. Then use separate quarters of the washcloth for each stroke. Then rinse the area well. For males, we are going to wash and dry the penis using firm stroke. If uncircumcised, retract the prepuce and clean the glans penis. Wash and dry the scrotum. Inspect the perineal area, then clean between the buttocks. The last step is we are going to document any unusual findings.